Hi friends, in this video I would like to discuss about shoulder bandage, that is shoulder spica bandage. In Ayurveda it's called as Swastika Bandha. Actually it's a figure of 8 bandage, but the exact name is shoulder spica bandage, and spica means the proximal part is wider than the distal part. It is also done in hip area and it's called as hip spica. Here we can see how to do a shoulder spica bandage in shoulder injuries. First, take a cotton pad which is of optimum thickness and then apply gauze over the cotton in which where we are applying the cotton. To avoid allergy, we are applying this gauze piece in between cotton and the body part to be applied. This is the first thing to be done in a shoulder spica bandage, a pad. The second thing what we want to do is a small ball to kept inside the axilla. This is to keep the shoulder in a functional position. The functional position of shoulder is a slightly abducted position, so that we are making a ball with cotton covered with a piece of gauze. Here you can see a piece of cotton is covered with gauze and made into a small ball to be kept inside the axilla. This is the second thing to be prepared before doing the bandage. First was a cotton pad covered by gauze, and second thing is a cotton ball covered with a gauze. Coming to clinical examination, here what we are examining is from sternoclavicular joint up to acromioclavicular joint. We are palpating through the clavicle to check whether there is deformity or fracture of clavicle. Here we are palpating anteriorly the biceps tendon, and this is greater tuberosity. Anterolaterally there is supraspinatus muscle, and this is Duga's test. Duga's test is ask the patient to touch the opposite shoulder along the side of chest. In anterior shoulder dislocation, this Duga's test will be positive. And the attitude of the patient immediately after injury is supporting the affected hand with opposite hand. Here you can see the reduction method, Koch's method of anterior shoulder dislocation. This is traction along the line of humerus with counter traction, then external rotation, adduction up to the midline of chest, and medial rotation. This is Koch's method, and here after the reduction you can see the technique is Duga's test itself, which confirms the reduction. Then coming to the immobilization, shoulder spica bandage, the cotton pad is applied over the shoulder joint, affected shoulder joint, and the ball is kept inside the axilla. Here you can see the ball is kept inside the axilla, and then it is tied. Here you can see the ball is kept inside the axilla and then it is tied. Then we are applying shoulder spica bandage. For shoulder spica bandage, it is better to use a Cora cloth with 30 centimeter width and 5.5 meters length, or you can use the same material, same 5.5 meter length into 30 centimeter width of a gauze piece. It is better to use a Cora cloth for the strength and firmness of the bandage. Actually, in spica, the proximal part, which is near to heart, is wider, and the distal part, which is covering the joint, it is narrow when compared to the wider part, proximal part. This is the typical feature of spica bandage, and a 3 rotation is made. A 3-layer rotation is made using the same Cora cloth, or you can take an additional bandage to the right shoulder if the right shoulder is affected, like this, to cover the gauze and cotton properly. And then at opposite axilla, you can just twist the bandage for the firmness. Here you can see at the opposite axilla, I am twisting the bandage. Total 3 covering is done. For a very large person, you should take 6 meter length. And for a small person, you can take 5 meter length. Here I am taking 5.5 meter length and 30 centimeter width of Cora cloth. And then it is tied over the opposite axilla. Here you can see this bandage is tied over the opposite axilla. An assistant should hold the tail of the bandage in the opposite axilla, and at the end of the bandage, we are tying the bandage in the opposite axilla. This bandage should be rebandaged in a gap of 7 days or 5 days as per the climate. Usually, I am changing in a gap of 7 days. In all shoulder dislocation, 3 weeks immobilization is must, so that in a gap of 7 days, I am doing rebandage. Or you can rebandage in a gap of 5 days. In acute injury, we are using Murivanna over the shoulder. And then pin is applied to keep the bandage in correct position to avoid rolling. Pin is applied like this. Then after the bandage, sling is also applied. An arm sling should be applied after doing shoulder bandage. This is to be kept for 3 weeks. And then after 3 weeks, rehabilitation should be started. This is regarding shoulder spica bandage. Or instead of shoulder spica bandage, you can also use shoulder immobilizer. Instead of shoulder spica, you can use shoulder immobilizer. For applying shoulder immobilizer, it consists of 2 parts. One is over the shoulder joint directly, like this. And the second one is through the belly and then keeping the shoulder in a slight abduction and in complete immobilization position. Here you can see. The second one is covering the abdomen, and then this particular 2 velcro are applied as same as of that of sling. That means if we are applying shoulder immobilizer, then there is no need of sling. Here you can see one is over the distal end of forearm and other is over the distal end of arm. Like this. In this particular position also, just like that of Cora cloth, shoulder spica bandage, the arm is completely immobilized. Here you can see. And after a gap of 2 weeks, you can keep free the elbow joint like this. Shoulder should be immobilized for a period of 3 weeks, but after 2 weeks of immobilization, elbow can be kept free and the rehabilitation for elbow can be started. Like this, after 2 weeks, the elbow part is kept free in shoulder immobilizer for early functional movements. This is regarding shoulder spica bandage and shoulder immobilizer. We are applying immediately after injury. In shoulder dislocation, 3 weeks immobilization is must. In supraspinatus acute injury also, we can do the same immobilization with shoulder spica or shoulder immobilizer, and it should be kept in a gap of 1 week to 3 weeks or 4 weeks as per the grade of injury. Thank you.